Here to talk about this with me is Rory Stewart, independent candidate for Mayor of London. Good afternoon to you.
Good afternoon to you.
We did not shake hands.
Did not.
I think it's important that we start to normalise some of these things because there are still people who resist it when you say that. I don't want to shake your hand. I'm not going to give you a hug just because I'm
And you
meeting
can feel under huge social pressure. I remember this because I was the Secretary of State responsible for responding to the Ebola crisis, and I went out to Eastern Congo, and I remember feeling very strong pressure when an old man would come up to try to shake your hand, but how important it was to say no.
You didn't want to offend.
And there are so many things that, as you imagine, that we do, almost without thinking about it, which are difficult to do. I, for example, am having to train myself not to touch my face, and these are not easy things to do, and we can all make mistakes all the time because many of these things are half
unconscious. Yeah. Tell me about the decision then in Cobra today. Is it the right one?
I feel the government should be moving faster, and I'm afraid that there are many reasons why governments tend to be too slow. One of them is simply that the costs of acting early are always very, very high. I would be, for example, shutting down all schools in London now.
If you were Mayor of London, you'd be doing that now?
Yes, because I think that you should have no regrets. This is the biggest single event we've had of this kind for 100 years, since the Spanish flu after the First World War. And we should have no regrets about acting quickly. There will be significant economic costs to doing it, but better to take those economic costs immediately and keep it short. And I think we are being too slow in responding.
How would you manage the human fallout from those economic shocks? So, for example, you close all schools. Mums and dads of the kids in those schools have jobs. Therefore, it now becomes the problem of their employer as well. How would you, as Mayor of London, how should the government, if we move into this phase, be managing those very human stresses?
I think very thoughtfully, very flexibly, very generously. Because, of course, doing these things, it's easy to say on radio. Doing it is going to be very, very tough for many people. Just thinking about my own individual life in a small way, I've got a 5-year-old who's in school at the moment. And, of course, what that will mean for me and my wife in terms of obviously having to be at home more, but also what it's going to mean for a lot of the economy of London. London is 90% a service economy.
So a lot of that will be hospitality, will be front-facing, person-facing, won't it?
Absolutely. And, of course, we make a lot of income from West End plays, from sports matches, etc. And I'm afraid we're going to have to move fast to limit the exposure. So I would also be banning large gatherings. And I think that the experience around the world is that the more aggressive you are in your containment measures, the better you do. I know there are disagreements about that. There are many people who think that the key thing at the moment is not to panic people, but I believe that in the end, the way that you reassure people is by being honest, by being transparent about the risks, and by acting quickly and decisively. And that if you try to reassure people by saying it's all going to be all right, that in the end undermines the credibility.
But to come back to that closure of all schools, I mean, I know as a former local radio journalist that on snowy days when all the schools close, it's like the world has ended. How do you make sure it doesn't feel like the world has ended when you close schools for maybe, between now and beyond the Easter holidays or something?
I think it is a huge thing to do. But remember, this is the largest single pandemic we've had in Britain for over 100 years. And if we end up in a situation in which 80 or 90% of the population ends up getting it, which is what happens if you start getting away from your containment phase into your delay phase, and you end up with even 1% of the population dying, that is potentially 100,000 people or more. It's a lot of people, and that is, of course, we immediately think of our own parents. My mother's 83, and I think that we should have no regrets, I'm afraid, about accepting the disruption and the costs and acting quickly. And I feel, and I've always felt this in government, I felt this when I was the minister dealing with flooding, I felt it when I was dealing with Ebola, I felt it when I was in Iraq and Afghanistan, that the tendency is always to be too slow. Governments are always too slow. So, for example, it is a total disgrace that a plane landed from Milan yesterday and not a single passenger off that plane was actually tested.
I spoke to one of them an hour ago and he felt the same. He was expecting more and there was nothing.
There's no excuse at all. Absolutely no excuse at all why those people were not tested. And one of the silly arguments being made is that many people are not symptomatic for 2 weeks. Well, that's fine. You may not catch anybody, but if you catch even one person, it's worth doing that testing.
And also, even if you're not symptomatic, I was quite surprised that for some time now, if you came back from northern Italy, and now even it still applies if you come back from the south of Italy, that you call 111 only if you're symptomatic, you self-isolate only if you're symptomatic. And I've had calls from people whose kids came back from ski trips and they've gone back into school and they were mixing with their siblings naturally at home and all the rest of it. And there seemed to be this unreality about it for people. And I suppose only often it's human nature, isn't it, that only something dreadful breaks through that unreality.
Well, it's very difficult to imagine what it's like when you get into a serious pandemic. So that's the first problem, that people imagine it's going to be much like it is today. I think the second problem is that there's a very understandable British tendency to want to say, keep calm, carry on, let's not panic. And we feel quite smug about it because it's, of course, something we were very proud of.
But you can keep calm and you can carry on and you can do the right thing.
100%. And I think we should pay much more attention to what is going right in China, in South Korea, in Singapore, in Japan. There's a tendency, which I don't like, to be a little bit smug and say, oh, well, of course, those countries do this, but of course we wouldn't do something like that in Britain.
And yet, you and I chatted briefly before we came on air, and I've said it on air in the last couple of hours as well, that I have just off my own bat over the last 10 days been socially distancing because of my elderly mother and other family members, that I just want to minimise even the tiny, it's small margins, isn't it? You want to minimise the possibility of getting these things. But I'm an individual, you're an individual. Messages that we send to whole populations are rather trickier to navigate, aren't they? From the government's perspective, is there a danger that when you as a potential London mayor say, right now, from today, I would be closing schools or making the decision to close schools, that there's a danger that can spread panic? We saw in Italy that once it was clear there was going to be lockdown, people scarpered in great numbers. Well, what were they taking with them when they scarpered?
So, Sheila, you're absolutely right. And this is one of the reasons why governments are very cautious about acting too quickly. They're worried that if you act too quickly, there are big costs. And they're also worried, as you say, that people are going to scarper and move. But I think you need to weigh that up against the bigger cost, which is that if you do not act quickly, these things get out of control. All the evidence suggests that the best time to close schools is before the cases are in the schools. If you wait until the cases are in the schools before closing those schools, it's generally too late.
And in families, which is likely to be the real hotbed of contagion, grandparents, do we tell, you close a school, do you tell the families not to go and visit their 83, 89-year-old grandparents? And if not, who's taking care of them? Who's feeding them? Who's making sure they're safe?
Yeah, well, these are huge challenges which you have to weigh up all the time. I'm afraid we all have to get used to, very sadly, during the few weeks when we're isolated, that there will be much less face-to-face contact. One of the great things, of course, today is that we can do more with digital technology. We can Skype people, we can do FaceTime calls. That's not going to answer all the problems that you're raising. We also need to get much better at getting the home testing kits to people. If we're going to make people self-isolate for 2 weeks and discourage them from going to the GP, which is quite the right thing to do because you don't want them carrying the disease into our medical system, then 111 has got to work better than it's working at the moment, and we've got to get the testing kits out to people in their houses.
I hear you, but I also can imagine lots of parents thinking, well, literally, if my kids can't go to school and I must continue to work in the NHS, for example, or as a carer, Nana, Grandad are the only people who can take care of the kids. Oh, hang on, they're over 65, they're over 70, whatever age they are. I can't put them at risk, so that's not an option. I mean, my question really is, what is the outer ring and then the outer ring of extra support that you as mayor, that government should be putting in place for those very real lived situations?
So I think the government needs to be very, very generous very quickly, both if I were the mayor, and also this is true for the Prime Minister, we need to spend a lot of money, to be frank on this. And we need to deploy a lot of people, including retired people. We need to get back retired police officers. We need to get back retired NHS officers. We need to ultimately, we may need to use military forces in order to do this if we get to the stage, because we need people. We need bodies, trained professional people out on the streets, doing home delivery kits, accessing people who are vulnerable or need assistance. All of that needs to happen, but the fact that it's
happening?
The fact that it's
is it being discussed, do you think? Is it inevitable?
It's being discussed endlessly, and all the plans are in place. But I think there are two things to remember. One is that what will happen in those meetings, and I've sat at these meetings in Cobra, is it's very difficult to get the experts to agree. There will be small disagreements. This disease is changing all the time. So in practice, people imagine that there is a single expert opinion which the mayor just needs to listen to. In practice, what you will find is one person saying, well, we didn't think the Chinese response was going to work, but the evidence over the last week is maybe it is working, or we thought that 3% of people were going to be infected, but actually it's only 1.5%, or we thought men were more vulnerable than women, but that's changing. This is a very, very new disease, right? We don't have any proper treatment for it. We don't have proper understanding. Second problem is that the specialists around that table in the COBRA meeting are specialists on narrow areas. So you can know a lot about epidemiology. That doesn't mean you understand about how a school system works. You're not an economist. You can't model what's going to happen in the private sector, which is why in the end you need leadership. You need people who make the call. And the big question always in any emergency response is not what to do, but when to do it. When to do it. When do you shut those schools? And my instinct is do it now, accept the cost, accept the anger of the public. I would much rather be in trouble in 2 months' time and accused of having overreacted and saved lives than the other way around.
But what about reacting, to the science proportionately and all the rest of it? But then nurses, social carers, carers who go into people's homes, typically not exclusively women, but more likely to be women, who are perhaps part-time, more likely to be doing more care of their children, are told, actually, your kids can't go to school now. My question really is just how much of a bulwark of financial support would be needed to be given, particularly to parents who are NHS workers, to make sure that children were cared for appropriately, that it didn't cost the family extra money, and that the parents were still able to go to work to treat those many thousands of people who will need treatment because of coronavirus.
So we need to very generously compensate people. We need to make sure that people are not losing out money.
And are you confident that will be in the budget this Wednesday? And if it's not, is that a dereliction?
If it's not, that's definitely a dereliction, because one of the big lessons from all these things is that if you don't compensate people properly, they start doing things.
Compensate or pay? Pay them a wage?
Either. The key point is that if people are driven to do things which are dangerous because they're not receiving enough money, then you get into a situation of terrible outcomes. So the government must spend. But remember, this is going to be a big, big cost to our economy in general, because we're going to end up in a world in which, very sadly, a lot of parts of our economy are going to suffer. The financial effects are now some of the worst we've seen since 2008. The oil price is now down at 50% of the level.
Hospitality service sector we've seen already.
All of that is the background. So, but the key point is that we need leadership, right? This is a time when we cannot afford to simply be pushing the can down the road.
Boris Johnson says science is the leader here, and he's following the science. Do you know different?
I absolutely, respectfully disagree, right? Of course, science is very important, but what I was trying to explain is that in practice, the decision is when you act. The scientists can tell you how the disease spreads. The scientists can tell you how many people are likely to be infected. The scientists can tell you what their mid-range estimates are. But only the leader can decide whether to close the school today or leave it another week. No scientist can tell you that, because these are judgment calls. You can't map the whole British population. And basically, you're one of two kinds of people. You're an act early person, or you're somebody who's hoping it's all going to be all right. And in this situation, act early, act early, act early.
We know that the COBRA meeting today decided against going into phase 3, I think it was, and into delay. But there's a meeting of scientific advisors to the government tomorrow. There's another COBRA meeting on Wednesday. Are we just really about to see a staggered version this week of what you're describing? Is that your sense of what you're calling for?
Yes, I think what we will find is that the government will eventually close schools. But the lesson from California, lessons from New York, is that they felt they should have done it 2 weeks earlier than they did. So we should be doing it tomorrow.
Thank you, Rory Stewart. Thanks very much indeed, independent candidate for Mayor of London.